I delivered my first baby vaginally after 18 hours of Here's the truth. They're both hard, they're both valid, and the best birth is the one where you and your baby are healthy. Today, I'm breaking down everything about vaginal birth and C-section that nobody tells you. The real recovery, the real risks, and what you actually need to know, because birth doesn't always go according to plan, and you deserve to be prepared for both. Hey everyone, I'm Diana, and welcome back to Sweet Pregnant. I'm a doctor specializing in women's health, and I'm a mom of 3. And here is what I've learned both professionally and personally to raise so much judgment around how babies are born. Vaginal birth is seen as natural and better. C-sections are sometimes treated like failures, but that's wrong. Both are legitimate ways to bring a baby into the world. Both have benefits and risks, and sometimes you don't get to choose. So today, I'm giving you the facts about both, what each one is really like, how recovery differs, and when a C-section becomes medically necessary. No judgment, just information. Let's start with vaginal birth. Vaginal birth, also called spontaneous vaginal delivery, is when the baby is born through the birth canal. This is what most people picture when they think of birth. And for about 68% of births in the United States, this is how babies are born. What are the benefits of vaginal birth? Faster recovery. Most women feel significantly better within 2 to 3 weeks. You can move around easily, lift things, and resume normal activities much faster than with a C-section. I was walking around the hospital room within hours of my first birth. By 2 weeks, I felt pretty much back to normal physically. Shorter hospital stay with an uncomplicated vaginal birth. You typically go home within 24 to 48 hours. Benefits for the baby. When the baby passes through the birth canal, their lungs get squeezed, which helps clear out fluid. They're also exposed to beneficial bacteria in the birth canal that help establish their gut microbiome. Some studies suggest this may reduce the risk of certain immune and metabolic conditions later in life, though the research is still evolving. Lower risk for future pregnancies. Each C-section creates scar tissue on your uterus, which increases risks in subsequent pregnancies. With vaginal birth, you don't have that concern. Immediate skin, skin, and breastfeeding. After a vaginal birth, the baby is usually placed directly on your chest. You can start breastfeeding right away if you want to. What are the downsides and risks of vaginal birth? The pain is intense and unpredictable. Even with an epidural, labor is painful. Contractions build in intensity. The pushing stage burns and stretches in ways you can't fully prepare for. Without an epidural, it's one of the most intense physical experiences most women will ever have. Perineal tearing or episiotomy? About 80 to 90% of first-time moms will have some degree of tearing. Most tears are minor first or second degree and heal within a few weeks. But some women have more severe tears, third or fourth degree, that extend into the anal sphincter. These require more extensive repair and longer healing. An episiotomy is a surgical cut made to enlarge the vaginal opening. It's less common now than it used to be, but it still happens in about 12% of births. Vaginal changes. Your vagina will stretch during birth. For most women, it returns close to its pre-pregnancy state within a few months, especially with pelvic floor exercises. But some women experience permanent changes. Sex might feel different. Things might feel looser. Risk of pelvic floor dysfunction. Some women develop urinary incontinence, leaking when you cough, sneeze, or exercise, or pelvic organ prolapse, when pelvic organs shift downward. Kegel exercises and pelvic floor physical therapy can help prevent or treat these issues. Hemorrhoids. The pushing stage can cause or worsen hemorrhoids. They're painful and annoying, but they usually improve with treatment. Unpredictable timeline. Labor can last 2 hours or 24 hours. You can't plan it. You can't control it. Some women find this empowering. Others find it terrifying. About 32% of births in the United States are C-sections. Some are planned elective sections, and some are unplanned emergency sections during labor. When is a C-section medically necessary? The baby is breech or transverse. If the baby is bottom down or sideways and can't be turned, A C-section is usually the safest option. Placenta previa. This is when the placenta covers the cervix. If you go into labor or the cervix starts to dilate, it can cause life-threatening bleeding. A C-section is required. Placental abruption. If the placenta starts separating from the uterine wall before delivery, it's an emergency. The baby needs to be delivered immediately. Fetal distress. If the baby's heart rate becomes concerning during labor, a C-section may be necessary to get the baby out quickly. Failure to progress. If labor stalls and the cervix stops dilating, or if the baby isn't descending despite hours of pushing, a C-section may be recommended. This is what happened to me with my second baby. I labored for 14 hours, pushed for 2 hours, and the baby just wasn't coming. His heart rate started dropping. We had to go to the OR, previous uterine surgery. If you've had a previous C-section, especially with a classical vertical incision, vaginal birth may not be safe because of the risk of uterine rupture. VBAC, vaginal birth after cesarean, is possible for many women, but it depends on the type of previous incision and other factors. Active genital herpes. If you have an active herpes outbreak at the time of delivery, a C-section prevents transmission to the baby. Multiples. With twins, vaginal birth is often possible if the first baby is head down. With triplets or more, C-section is usually recommended. Maternal health conditions. Certain heart conditions, brain conditions, or other maternal health issues may make pushing unsafe, requiring a C-section. A C-section is major abdominal surgery. You're awake during the procedure, unless it's an emergency and you need general anesthesia. To raise a curtain at your chest so you can't see the surgery. Your partner can usually be with you. The procedure itself takes about 45 minutes to an hour. The baby is delivered within the first 10 minutes. The rest of the time is spent removing the placenta, checking the uterus, and closing the incision in layers. What are the benefits of a planned C-section? You can schedule it. With an elective C-section, you choose the date, usually around 39 weeks. You know when your baby is coming. No labor pain. You skip contractions entirely. You go to the hospital, get the epidural or spinal block, and the baby is born within an hour. No risk of perineal tearing. Your vagina and perineum are untouched. What are the downsides and risks of C-section? It's surgery with all the risks that entails. Infection at the incision site or in the uterus, heavy bleeding, postpartum hemorrhage, blood clots in the legs or lungs, injury to nearby organs like the bladder or intestines, rare but possible. Adverse reactions to anesthesia. Recovery is longer and harder. For the first few days, it hurts to move. Getting out of bed feels impossible. Sneezing, coughing, or laughing is painful. You can't lift anything heavier than your baby for 6 weeks. No driving for at least 2 weeks. It takes 6 to 8 weeks to feel reasonably normal. And some women take longer. The incision. You'll have a horizontal scar across your lower abdomen, just above the pubic hairline. The area around the scar will likely be numb for months or even permanently. The nerves are cut during surgery, and they may never fully regenerate. I still have a numb patch above my C-section scar 3 years later. Delayed skin to skin and breastfeeding. Depending on the circumstances, you might not get to hold your baby right away. Sometimes the baby needs to be checked by the pediatric team first. Breastfeeding can be harder to initiate because movement is painful and certain positions are uncomfortable. Risks for future pregnancies. Each C-section increases the risk of complications in future pregnancies, including placenta accreta. Placenta grows too deeply into the uterine wall. Placenta previa, more common with prior C-sections. Uterine rupture, rare but life-threatening. Most women can safely have 2 to 3 C-sections, but after that, risks increase significantly. Emotional impact. Some women feel disappointed or like they failed if they needed a C-section, especially if it was unplanned. This is not rational, but feelings aren't rational. If you feel this way, please talk to someone. You didn't fail. You brought a baby into the world safely. That's success. Let's talk about recovery, because this is where the biggest difference lies. Vaginal birth recovery. First few days, you'll be sore. Walking feels weird. Sitting might hurt. Going to the bathroom is scary, but gets easier. Use ice packs, sitz baths, and pain medication. First 2 weeks, the soreness decreases significantly. You can move around easily. You can do most normal activities. 6 weeks, most women feel mostly healed. You're cleared for sex and exercise at your 6-week checkup. C-section recovery. First few days, moving is painful. You need help getting out of bed. You're on strong pain medication. Walking is encouraged, but it's slow and uncomfortable. First 2 weeks, you're starting to move more easily, but you're still limited. No lifting, no driving, no strenuous activity. The incision is healing but still tender. 6 weeks. You should be feeling significantly better and cleared for normal activities. But some women still have pain or fatigue. Long-term, some women feel completely fine. Others have lingering pain, numbness, or scar tissue issues. The emotional difference. With vaginal birth, Therese often a sense of, I did it. It's over. With C-section, especially an unplanned one, there can be feelings of disappointment, failure, or trauma, even though those feelings are undeserved. Both births can also be empowering and beautiful. It depends on your experience and how you process it. VBA stands for vaginal birth after cesarean. If you've had one C-section, you may be a candidate for VBA with your next pregnancy, depending on several factors. Who can have a VBA? You had a low transverse horizontal incision in your previous C-section. This is the most common type. You don't have any conditions that would require a repeat C-section like placenta previa. Your hospital is equipped to handle emergencies, including emergency C-sections. You haven't had more than 2 previous C-sections. Why would you want a VBACE? Faster recovery. Avoid the risks of repeat surgery. Experience vaginal birth if that's important to you. What's the main risk? Uterine rupture. The scar from your previous C-section could tear during labor. This is rare, less than 1%, but serious. If it happens, it's a medical emergency requiring immediate C-section. My perspective, VBA can be a great option for the right candidate, but it's not for everyone, and that's okay. Some women really want to try for a vaginal birth. Others prefer the predictability of a scheduled C-section. Both choices are valid. Here's the question everyone wants answered. His better, and here's my answer. Neither. They're different. They each have benefits and risks. The best birth is the one that gets you and your baby through safely. If you have a choice, some women with low-risk pregnancies can choose an elective section. Others strongly prefer vaginal birth. Think about what matters most to you. Do you want to avoid labor pain entirely? C-section. Do you want faster recovery? Vaginal birth. Do you want to avoid surgery and its risks? Vaginal birth. Do you want a scheduled, predictable delivery? C-section. Do you want to minimize risks for future pregnancies? Vaginal birth. But often, you don't have a choice. Medical necessity dictates the safest route for you and your baby. And when that happens, the only right choice is the safe one. I planned a vaginal birth for my second baby, but when labor stalled and his heart rate dropped, we went to the OR. Was I disappointed? Yes. Did I feel like I failed? At first? Yes. But you know what? My baby was born healthy. I recovered, and looking back, I'm just grateful we were both okay. Don't let anyone shame you for how your baby was born. Not other moms, not family members, not random people on the internet. Your birth story is yours, however your baby arrives. You did it. You're a mother. That's what matters. So let's recap. Vaginal birth, faster recovery. 2. 3 weeks shorter hospital stay benefits for baby lung clearance. Microbiome lower risk for future pregnancies, but intense pain, tearing, pelvic floor risks C-section. Major surgery with surgical risks longer recovery. 6-8 weeks. No labor. No. Perineal trauma can be scheduled if elective risks for future pregnancies when C-section is necessary, breech baby, placenta previa, fetal distress, failure to progress, previous uterine surgery, active herpes, maternal health conditions. VBA is possible for some women who've had one C-section with a low transverse incision. The most important thing, A healthy mom and a healthy baby. That's the goal. How you get there doesn't make you more or less of a mother. If you had a vaginal birth, you're amazing. If you had a C-section, you're amazing. If you had both, like me, you're amazing. Birth is hard no matter how it happens. Give yourself credit. If this video helped you understand your options better, hit that subscribe button. My next video is all about the second trimester, the so-called easy months that aren't always easy. Drop a comment and tell me, how was your birth experience? Vaginal, C-section, or both? Let's share our stories without judgment. You're going to do great, no matter how your baby arrives. I'll see you in the next one.